in France in 1975, and the vaccine was licensed in 1981. There was always a risk of a contamination with other agents at the same time. So since 1986, recombinant vaccines were produced in yeast, avoiding the problem of contaminations. We can roughly state today that a perinatal vaccination protects approximately 75 to 80% of children born to hepatitis B virus positive mothers against the subsequent persistence of this type of infection. Whereas without vaccination, 80 to 90% of them would become chronic carriers for a lifetime. And an initial positive trend in the reduction of HPV-linked liver cancers was noted initially in Taiwan, where a compulsory vaccination was introduced for all newborn children in 1984. And ever since then, the vaccinated patients have been followed up, and it was shown in 2009 by Dr. Chang and a number of her colleagues that perinatally vaccinated children, after 20 years follow-up, revealed a 70% reduced risk for liver cancer in the subsequent 20 years when compared to non-vaccinated groups. Here you have to keep in mind that hepatitis B vaccination in about 5% of cases does not lead to an antibody response. The reasons are not always understood, but those patients remain susceptible subsequently for the infection. So in a way, with hepatitis B virus, we have the first vaccine available which prevents an infection causing a widespread human cancer, and where we have already proof that this cancer is being prevented. Now, primary prevention of cancer can be also achieved by treating persistent infections. I mentioned this already for Helicobacter pylori and also for schistosoma infections. There's clearly evidence right now for HIV infections that the so-called HART therapy protocol, if applied in those patients, seems to reduce the risk. First of all, it reduces the load of the HIV infection in the respective patients. It does not eliminate the virus, but it reduces also, as data from Africa indicate, the risk for subsequent development of Kaposi sarcomas and probably also of B-cell lymphomas as a consequence